Hi, everyone, and welcome to today's webinar. I'm Laura Pata, Director of Customer Success and Marketing here at Infinix, and we'll be moderating our discussions today. Our topic today is optimizing your orthopedic practice's patient access workflow using augmented intelligence. If you have any questions during the presentation, just write them in the chat box, and we will review them at the end of the presentation. Before we get started, I'd like to introduce our presenter today, Michael Mahoney. Michael has been a part of the Infinix team for almost a year as our Business Development Director in the Northeast, Mid-Atlantic, New England, and Midwest states. He has deep healthcare revenue cycle expertise in developing and implementing client-focused solutions for healthcare executives. For the past 25 years, he's held new business development positions within the healthcare technology and revenue cycle startups in Fortune 500 companies. So with that introduction, I'll hand it over to you, Mike.
Well, thank you, Laura, and welcome everybody. Good afternoon on a Thursday afternoon here. Appreciate everybody joining. My goal today is to walk you through how Infinix's patient access platform can allow for a single comprehensive financial solution that will verify eligibility, retrieve benefit information, as well as provide out-of-pocket patient pay estimates that can be collected at the time of service during your practice. So by leveraging artificial intelligence, with payer and clearinghouse automation, along with our own patient access specialists, our platform will be able to evaluate prioritization requirements and electronically submit those cases to the payers, and more important, be able to perform follow-up to get approval. So my goal today is let's talk a little bit about who Infinix is. I'll do a little bit of a deeper dive through a couple of slides, to give you a flavor of our approach to prior authorization. And then what I will do is I'll pause and then take a moment and switch screens and actually show you the application and show you some of the functionality. So again, we are Infinix Healthcare. We were founded in 2012, specifically focusing on revenue cycle solutions for the healthcare market. We focus on hospitals, physician groups, diagnostic service companies, etc. But our specialties range from orthopedics to radiology, cardiology, etc. Just to give you a sense of geography, our headquarters is in California. We have product support, product development located in a couple of offices in Texas. I myself are located in New Jersey, so we're covering a number of different geographic areas / time zones for you. But let's just talk about the specialties, because we're here today to talk about orthopedics. So just wanted to take a little bit of a deeper dive into orthopedics. From our perspective, we look at it from orthopedics, from surgeries as well as non-surgical procedures that would include imaging, MRIs, for example, pain management, OT, PT, viscos, etc. Our approach is to be very flexible to come up with customized scopes for your practice. And what I mean by that is we don't look at it from an all or nothing approach when we come to engagements. We have orthopedic practices that ask us just to focus specifically on surgeries, or we can focus on non-surgical procedures. So we're very flexible to be able to provide the right solution for your needs. And as you can see on the slide, we always like to show some of our clients, and a few of those are specifically dedicated to the orthopedic market. One takeaway before we move on to the slide is our solution is very scalable. And what I mean by that is, for example, RadNet. And again, I know RadNet is imaging, but they're submitting well over 1 million prior authorizations through our system each year. But as I said, we are scalable. So what that means is we contract and partner with practices that are submitting 200 prior authorization requests a month. So again, I guess the main takeaway from this slide is we're very flexible when it comes to the scope of services. Like I said, in the orthopedic world, it can be surgeries or it could be non-surgical procedures. And then the volumes we are very flexible when it comes to volumes as well. So moving on, as I mentioned, we started out and our primary focus is on revenue cycle solutions. And we typically break that out into pre-care and post-care services. So just to touch on a couple of these that are shown on the slide is, we look at it from a front office as well as a back office perspective. So from the pre-care or front office patient access area, as you can see, and these are some of the areas that we're going to discuss today, we're going to talk about insurance verification and benefits, or many of you basically say eligibility and benefits, I should say, patient pay estimation, as well as prior authorization. But the other key takeaway from the slide, and we can certainly have a dialogue at your convenience, is post-care as well. And especially in the orthopedic world, we have extensive experience doing medical coding and billing and follow-up denial management. So again, we offer end-to-end revenue cycle solutions for orthopedic practices. So let's just do a little bit of deeper dive into what you may be experiencing today. So I've had a chance to talk with a number of orthopedic practices, and we've discussed a number of challenges that they are facing as part of what we call the pre-care operation or functionality within your practice. And it all affects the patient experience. So we're seeing, we get information or feedback around patient referral, very paper or faxing dependent. From eligibility and verification, the messaging we always get is, challenges with incomplete patient information, as well as lack of benefit verifications. Our system also includes patient estimates, and that's one of the other pain points that we hear out there. And again, it just, what we're hearing is limited collection capability at the point of service. From a prior authorization percentages, we just hear challenges with regards to clinical reviews, as well as just the overall patient turnaround time to get things approved, which impacts your patient experience and scheduling. And lastly, the area of delaying post-service, as well as limited transparency on the out-of-pocket costs. So all these impact your revenue and overall patient experience. So moving on, as Laura had mentioned, the fancy word we're using today is augmented intelligence. Now, artificial intelligence is a very common term that's in our world today. But we're seeing a transformation from artificial intelligence to augmented intelligence. And what I mean by that, in reality, we're seeing that in the healthcare space, most healthcare processes still need a combination of artificial intelligence and human clinical decision making to make it effective, and is supported by the American Medical Association. So let's talk about a sample case study or current client of ours. So they came to us with a number of different challenges, including a high denial rate, as well as the challenges of just scheduling the patients to be because due to the turnaround times for approvals from the payers, and also just revenue leakage. So they were experiencing a lot of challenges. So they came to us, and we were able to provide them a solution, first of all, that was AI driven. Also, one of the differentials from our solution is the fact that we incorporate patient access specialists. So it does provide a complete end-to-end solution to our clients. Seamless integration with the EHR system was important, and any sort of integration does provide a more efficient workflow of being able to get the information out of your EHR, as well as the approval information back into your EHR. And finally, we provided them real-time analytics and reporting dashboard because we really believe in full transparency in the process. So the results, as you can see on the screen, is significantly reduced in the denial rates. The turnaround time was decreased, which improved patient care and satisfaction, as well as we were able to save them a significant amount of money on administrative costs. All part of our augmented intelligence, patient access solution. So let's take a little bit of a deeper dive into our patient access solution, our approach to patient access. So what you're seeing on the screen is what we call our three-prong approach, or for many years I've used it as people, process, and technology. So we incorporate automation into our solution. And the key benefit to our clients is the fact that automation, through the significant amount of connections we have to payers as well as benefit managers, that gives our clients the ability to automate that process utilizing our tool. And it eliminates our client staffs having to make all those phone calls, doing all those faxing, or reaching out to those payer portals. We eliminate that through automation with our patient access solution. Another component is artificial intelligence. And where that comes in is we want to make a determination as early in the process as possible to make a determination if a prior authorization is needed or not. We want to avoid having to send a prior authorization request to a payer, then all of a sudden after the fact be notified from the payer that a prior authorization wasn't needed. So we make that determination early, and we notify your staffs of that decision. And then finally, the third part is patient access specialists, which kind of differentiates us from a lot of other solutions out there. And the specialists come in a couple of different areas. First of all, on the initiation process. Now, I wish I can say that all payers are set up and they can accept electronic submission of prior authorization requests. We still come up with payers that just don't have that capability. So here's where our specialists come in. So if our system receives a request and makes a determination that it can't send the prior authorization request directly to the payer, instead of sending it back to you and your staffs, we incorporate the specialist. They would be alerted of the specific exception, and they would take responsibility of initiating the request, either through fax or making phone calls, etc. So we relieve you of that manual process and take full responsibility, 100% ownership of the prior authorization initiation process. But another area where the specialists come in, and it's important, is the follow-up area. Now, in an ideal world, we would get the approval, and then we would send it back to you or to your EHR through a potential integration. But there's times when payers do deny the request, and it could be for peer-to-peer review, it could be for additional clinical notes. So the process that we've incorporated is, first of all, we are constantly updating or reaching out to the payers to get updates on the requests. If we get a denial, our system would be updated, and I'll show you that in a moment when I switch screens and go into the system itself, okay? But also, or the system notifies our specialist to do the initial triage or due diligence, basically calling up the payer or reaching out to them and find out why did they deny it. In essence, just at starting the appeals process. So they would try to learn from the payer to determine what are they looking for. It could be a situation where we already have it in place. Maybe they just missed it. But then they would communicate back to your staffs, typically through email, to let you know of the denial and specifically what the payer is asking for. So again, we are trying to make 100% coverage of the process from initiation to follow-up and approval. So let's take a further deeper dive into our system, and this kind of helps set up the demo itself, okay? So how does our intelligent patient access platform work? On the left-hand side is how do we get the data into our system? It's a question I get asked every time I do a demo. And we have a number of different options that we can provide to you or offer to you in basically, specific situation that you're in today. So the most ideal and most efficient workflow would be to have an integration with your EHR system. So the benefit there is that your staff would continue working in your EHR, but then the IT guys would set up some sort of trigger to be able to send that information directly into our portal or system to be able to eliminate double data entry. And we can do that through the integration of our two systems. But we do come up with some situations where maybe an interface or integration is not available. So we have a couple of other options as well. We, of course, have manual data entry where each of your staff would have access to our system to enter the information in. We also try to come up with a hybrid model as well, and it's called a bulk upload. Now, again, I won't go into too many details at this time, but just to give you a sense that if you can pull the data out of your EHR, put into a specific type of CSV file in the format that we require, we'll be able to upload that into our system, thus automating the data entry part without an interface. And the last option just to put out there is that we have customers that have actually asked to have our people access their EHR and do a lot of the manual data entry as well. So we can certainly have a dialogue and talk about automating that process to be able to get the information. And then once it gets into our system, we start this four-step process. So step one, so we looked at it from the perspective of we have eligibility and benefits. We also have a solution for prior authorizations. Two types of workflows that you might be experiencing today. What we've done with our intelligent patient access platform is we've been able to take these two solutions but combine it into one workflow. And that's what you're seeing today. So once we get the information from your EHR, we will be able to immediately verify eligibility coverage and provide you and retrieve benefit information on the patient. As well as, more important, this is incorporated into our solution, is patient out-of-pocket estimates as well. So that starts the process, verification. And then in tune, basically, we set up, and as I mentioned earlier, using artificial intelligence, we'll be able to make a determination if a prior authorization is required or not. As I mentioned, it's an important step because we want to make that determination early in the process. So if our AI, machine learning, brains of our system makes a determination that a prior authorization is not needed, you would be notified. And we've done it even before we've sent the request to the payers. And then moving on, we initiate this for you. And as I described earlier, we look at it as providing you an overall solution for % initiation of the request. So we want to have connections. We want to send the request directly to the payers, or we work directly with benefit managers. But in those exceptions where electronic submission is not available, our specialists, as I described earlier, would take responsibility of submitting those requests, and then it avoids sending those requests back to your staff. Kind of defeats the purpose of an automated system. So we want 100% coverage of the initiation process. And then lastly, our system is constantly pinging for updates from the payers. In the ideal world, we would get an approval. And through that integration that we could potentially have between our two systems, we would send the approval information back into your EHR, through the integration, thus giving you the ability to continue with the claims process. But as I described earlier, there's always those exceptions where requests do get denied. So what happens is our system is automatically updated with those denials and the reasons. Again, it could be additional clinical notes. It could be a peer-to-peer review request. In addition, our specialists would be notified, so that they would reach out to the payer to make determination of exactly what the payer is looking for. They would update our system with the results of their conversations with the payers, as well as send notification to you and basically work together as a team to get these requests approved. So again, overall process, from end to end, that's the core of our solution. And then lastly is, okay, so what are the results? And I've touched on a little bit of some of the benefits that our patient access platform provides to you. So we've touched on with regards to a bi-directional interface, we always want to have those conversations to be able to provide a more efficient workflow between our two systems. We speed up the approval process. We initiate requests typically within 24 hours, but we can expedite that process through our priority statuses to be able to initiate requests within 30 minutes. We also, we use AI and through automation, as I described earlier, to be able to automate as much of the workflow as possible. Again, focusing on eliminating having your staff having to go out to all those portals, eliminating all the faxing, phone calls that you're currently doing now. We take full responsibility of that, and we want to be able to automate as much of those processes as possible. And again, what differentiates us from other solutions that we're not just technology only. We have specialists that are dedicated to your account that know orthopedics. And in addition to that, orthopedics can be defined as surgeries, as I mentioned earlier, MRIs, viscos, et cetera. They are all experienced in those areas that would be able to handle any sort of manual or complicated prior authorization requests. And lastly, another huge benefit of our solution, which I'll show you shortly, is not only do we offer you a portal to be able to process and automate the prior authorization and eligibility and benefits process, but we also include real-time analytics and dashboards that are available at your fingertips, because we truly believe in transparency of the overall process. So at this point in time, I know you're probably tired of looking at specific slides, et cetera. So I'm going to stop sharing for a moment. I'm going to switch over my screen and go into the portal itself. So bear with me for 1 second. I'm going to share my screen and bring up a new system. Okay. So what you're seeing here is each user would have his or her own unique username and password to be able to access our system. So that's what I'm doing right now. So I'm going to log into our system. Internet's a little slow, so I apologize, but what we've entered in is our landing page or our patient access solution. So let me describe a couple of things that we're looking at right now. Okay, I always like to describe this as one-stop shopping. And what I mean by that is, here's our portal. And if your staff needs to do any sort of research or work on any sort of denials, you come to one place. The heavy lifting of the process is done behind the scenes. And what I mean by that is we have a large amount of relationships and connections to the various payers and benefit managers that are out there today. So again, as I mentioned earlier, what our automated solution provides to you is one area, one-stop shopping, that your staff would not have to go out to all those various portals to be able to initiate or follow up on prior authorization requests. So as you come into the screen, immediately we do like to use icons. So on the right-hand side, we have a progress column, and any case that's got a green check mark next to it indicates a finalized case. Any icon or case that's got a red triangle with an exclamation point indicates action required. So as soon as I come into the portal, visually I can see cases that need my attention. But we've taken it to the next level. So as you can see in the top of the screen, we have a number of tabs: current, completed, draft, canceled. So now we're starting to give the user options of how to organize the screen to basically give them the ability to look at specific types of cases. And then we drill down to a secondary level, which is our filters. So a user has the ability to filter out specific types of case by dates of service, by insurance, by facility or location, but more important is statuses. And as you'll see throughout the next couple of minutes of my demo, we really rely on statuses to be able to give you the information and also let you know where these requests are during the overall process. So I always use, as an example, if I came into your office on Friday morning, I can log into the Infinix system, and then I can look at these different statuses, and maybe I just want to focus specifically on those cases that need my attention that payers have asked for additional information or pending information. So I can click or unclick any type of status, and it's a way that we can slice and dice or filter the screens, again, creating a little workflow tool for your staff. So I always like to emphasize that we're very flexible and we can start customizing the screen for the user to specifically focus on what they want to work on today. So what I would like to do is let me show you some examples. First of all, I like to bring up what our data entry screen would look like. Now again, let me go back to what I had described earlier. Okay, we have a number of different options that we can work with you on how to get the data into our system. Again, the more ideal situation, the most efficient workflow would be to have an integration between our two systems. The advantage there is we would be able to push and get the information out of the EHR automatically, which would basically autofill these various fields so that we can continue with the prior authorization process and initiate the cases for you. And then we have that bulk upload, which is kind of a hybrid version, again, to be able to auto-populate these fields. So I always just like to emphasize that we want to go down that road of automating that process. But just for the demo, I always like to come up and show you the screen to show you everything is on one scroll down menu. So as you can see here, we do capture and request ordering physician information, and any field that's got a red asterisk next to it is a required field. So I'm just going to scroll down and show you some examples of the information that we'd be capturing, as well as information you can add into the system as well. So we have patient information, we've got service information, and one area that I already talked about is we can always prioritize to create stat requests as well to be able to initiate the request quicker. We have insurance information that we'd be pulling from your EHR, and we have the ability to work with 4 insurance carriers. And then more important is the procedure diagnosis code as well as clinical notes. So again, in the ideal world, we'd be pulling the information out of your EHR system through an integration. But I think the key takeaway at this point in the demo is that we have the ability to attach or upload clinical notes to the case to be able to submit it to the payers, as well as if the payer receives a request and they've denied it because they need additional clinical notes, we also have the ability for our clients to upload additional notes and send it back to the payers. So it's an important feature that I always like to highlight, and we can certainly work out the workflow on how the notes get into our system. That could be through the integration, it could be your staff, it could be our staff, a number of different options. But the key takeaway is that we can attach clinical notes at the time of initiation, as well as send notes back to the payers. So at this time, let me close out, and let me show you a couple of examples that we've got built into the system to show you how our patient access system works. So I'm going to bring up Christopher Lewis, and as you can see, he's an example of a completed or finalized case. So let's look at the information that's been brought over. Again, let me emphasize that we're talking about eligibility and benefits as well as prior authorization. 2 typically separate workflows, but our intelligent patient access system has created one single workflow for both those processes. And what I'm showing you on the screen is an example of that. So in this example, Christopher Lewis is the patient, and we've immediately identified that he is eligible for the procedure that we've submitted through our solution. So as you can see, eligibility status indicates that for this specific procedure at the procedure level, we have identified it as being eligible from Cigna. That's the first key step of the process, being able to provide you eligibility and benefits at the procedure level. And we brought over information from Cigna that's at the fingertips of your staff to show you copay information, deductible out of pocket, and the the nice additional feature that I keep emphasizing on because it's included in part of our solution is a patient pay estimation function as well. So just on this one screen, we brought over a lot of information, but you can also look at additional benefit information for this patient as well. So there's a hyperlink, what I call, or view benefit details. If you click on this, now we've actually retrieved the overall benefit information for Christopher for this specific payer. So as you can see, we're providing you not only the subscriber information, plan information, which includes coinsurance, copay, out-of-pocket max and remaining, and deductible information. So again, in summary, is not only are we verifying eligibility, but we're also retrieving benefit information as part of one workflow for our system. So at this time, let me close out. Okay. And I'm going to go back into our system. And let me show you an example of another patient that we have set up. And this is going to be an example, Kylie Smith, where action is required. So again, screens are similar. We have verified eligibility for the procedure that's been submitted to Cigna. As you can see, we brought over some information from Cigna. But the key difference here is that we've also initiated and sent out a prior authorization request for this specific procedure. And what it's showing to you is, number one, we've indicated that for Cigna, they have denied this request, and they're asking for additional information. So as you can see, the status has changed to pending information. And the benefit here is that, and as I previously described on the screen prior to this, is that you'll be able to, with that status field, be able to bring up a specific status for pending information to be able to work on cases that need my attention, maybe for additional clinical notes, et cetera. The other thing that I want to emphasize on this screen is that, again, as I described earlier, our specialist would be notified of this denial and immediately, and they would jump in and do the initial triage or due diligence. They would reach out to Cigna to determine what are they asking for. And as you can see on the bottom of the screen, we date and time stamp the communication. And in this case, our specialist, Randy, has documented that there was additional clinical notes that are being requested by Cigna. So this is just a case of a denial where our system has been updated. Number two, our specialists have been notified and they've reached out to Cigna. And the last part of the workflow is that they would communicate back to you, typically through email, to let you know of this denial and specifically what Cigna is requesting. Now, if you have peer-to-peer review requests, the process is very similar. As I showed you earlier, under the status filter, we have a specific status for peer-to-peer review. So in this case, the status would indicate peer-to-peer review. Our specialist, what the payer is asking for, and then they would notify you of the peer-to-peer review. We do not schedule for peer-to-peer reviews, but we would notify and work with your staff on getting them scheduled and completed. So you would have control of the provider schedules. We would just notify you of the request. So that was just an example of a situation where the case has been not denied. So in summarizing, at least at this point in the demo, is I showed you one-stop shopping, as I called it, our portal, our landing page. But behind the scenes is all the heavy lifting where we have all the connections to the payer managers, to the payer portals, to be able to initiate and request updates, follow-ups, et cetera, from the payers. So again, it eliminates your staff having to do all that faxing, all those phone calls, as well as reaching out to those portals. The other feature I like to be able to show you before I pause is, as I mentioned earlier, we also have real-time reporting and analytics. So again, I just jumped to a different access screen. Again, it's username and password driven. So I'm going to bring this up, and this is a great management tool that's offered to you as part of our solution. And as you can see here, we've already created a number of dashboards from feedback from our clients. So you'll be able to look at real time for prior authorizations, the number of cases sent, turnaround time, finalized cases, top exams, top payers, your top facilities, authorization percentage, denial percentage. So we've already created a number of dashboards that are at your fingertips. And if you go to the left-hand side and you wanted to do some additional analysis, like looking at your top payers, for example, you can click on that and you can look at your top 20, your top 15. You can create your own, date, to and from date period. So it is very flexible. But the other part of it, which is a nice feature, is that we've created a report builder option for you as well. So what you're seeing on the screen is the data elements that are in the system that you can report on. So it's just simply clicking or unclicking the specific fields for the report. You can choose your time period, to and from date period. And once you've, confirmed what you want to report on, you would just, confirm, and the report would come on your screen. And we do have clients that actually taken the next step and asked us to be able to take that information and potentially download it into like a CSV or an Excel spreadsheet. So again, a very strong management tool to give you real-time visibility into our system. So let me just summarize once again that our solution, our patient access platform, provides one-stop shopping, one portal to be able to verify eligibility, retrieve benefits, to be able to initiate and follow up and get approval for prior authorizations, as well as the real-time analytics and dashboard tool that we would provide to you as well.